So in this video, I'm going to talk about which patient you are going to see first, right? So during your Nclex exam, you will see a lot of question which patient nurse going to see first, right? So I'm gonna share some technique with you, and hopefully after that you will be able to get your answer correct. And we're gonna do 5 practice question, and you will see how easy it is going to be for you to get your answer correct, right? So we're gonna do like 5 question each video. So this is our first video, and now on we're gonna do like few videos, and we will do 5 practice question each time. So let me remind you one thing. There are like, let's say there are 5 points, right? There are 5 points. So I'm gonna only discuss about 4 points. The fifth point it will be hierarchy that I am not discussing in this video. So only 4 points we're gonna go over. Hierarchy, when the patient need food, water, oxygen, that one. But in this video we are not covering hierarchy thing. We only gonna cover 4 main points, right? So the 5 main points that you need to know is, first is airway breathing circulation, right? The second point you need to know is stable versus unstable. The third you need to know is chronic versus acute. Fourth you need to know is expected versus unexpected. And fifth one, if I don't intervene, patient will die. If I don't do anything, the patient will die. So which patient is going to die first if I didn't do nothing, right? So now we're gonna solve based on this. Let's solve. So my first question is, again this question are available online for free practice. I just got for study purpose. Okay, so now we're gonna do 5 practice question. So when we do 5 practice question, each option we have to see, is it asking for airway breathing circulation problem or acute versus chronic problem, or if they are not asking about ABC, check for the next category. Is it acute versus chronic? If that is not asking, then go to third category, which is stable versus unstable. Now go to expected versus unexpected, or fifth one, if I didn't do anything, the patient is going to die, right? So based on this 5 category, we're gonna go find our right answer. So let's go number 1, question number 1. A nurse is starting a shift and has received a report on 4 patients, right? Which patient should the nurse assess first? So check if any option has ABC problem, airway breathing circulation. If there is no ABC, then go to next category, which is acute or chronic. So let's see. So a 66-year-old receiving a blood transfusion who is now reporting flank pain and has a fever. So when you see word now, that's mean acute problem, right? So that would be immediately bring your answer correct. That would be your right answer. Answer A is your correct answer. That comes under acute versus chronic problem, right? Acute means something just started. So that would be your answer. If you don't be, if the patient is receiving a blood transfusion and complaining of flank pain, that's mean they say blood transfusion reaction happen, which could be life threatening. So that means your correct answer would be answer A. Other 3 options are stable. That's come under stable versus unstable category, right? A 52-year-old requesting snack, stable. 78-year-old IV infiltrate, stable. 45-year-old returned from the surgery, groggy and anesthesia, that is expected, right? Expected versus unexpected. So expected means you don't have to do nothing, that is expected. So that is your right answer, answer A, right? Move on to next question. A nurse receive a report on 4 patients, right? Which patient should the nurse assess first? So check for ABC first. Is there any ABC category? A patient who underwent a thyroidectomy and is reporting difficulty swallowing and feeling of fullness in the neck. That is your ABC problem, right? The patient has thyroidectomy and reporting difficulty swallowing and feeling of fullness in the neck. That's mean after thyroidectomy the patient could develop hematoma, which could disturb the airway, right? So that would be airway breathing circulation problem, right? So that would be airway problem. The option number 2, patient 2 days post appendectomy is requesting pain medication, that is stable, right? Option C, 3-hour post cholecystectomy 550 ml, that is expected, right? A patient 1 day post op hip replacement, stable, that is stable, right? So your answer would be answer 1. That would be airway breathing problem, right? Just imagine difficulty of swallowing and fullness of neck. That's mean airway is compressing. So that's how you're gonna select your answer. Next question, the nurse on a GI unit is receiving the status of 4 patient, right? Which patient is the highest priority? A 60-year-old who is 1 day post hemorrhoidectomy reporting rectal pain. That is expected, right? Option 2, a 30-year-old GERD is reporting heartburn after eating. Stable patient, right? He's not gonna die. There is no ABC problem in this, right? Option C, a 40-year-old with liver cirrhosis who is now confused and has flapping tremor in their hands. So option C would be your right answer, as this is stable versus acute versus chronic, right? Acute means something just started, as a word should bring you, which who is now confused. That's mean acute problem. So that would bring your answer immediately to answer option C. Question 4. The nurse in long-term care facility is receiving the morning report, right? Which resident should the nurse assess first? 82-year-old resident with UTI reporting persistent dysuria. So that is expected, right? Patient with UTI will have painful urination. 80-year-old resident with a history of heart failure who is now new onset moist cough and bilateral cracker. See, that would be your answer. That is ABC problem. ABC problem as well as acute problem. So that's bring to your answer option B immediately. So patient is 80-year-old who has a heart failure and has a new onset of moist cough and bilateral cracker. So breathing issue as well as acute problem. So that would be your answer immediately. Other option I'm not discussing. Those are stable one. The nurse hears several call light and alarm going off on the respiratory unit, right? Which situation requires the nurse immediate intervention? The high pressure alarm is sounding on the ventilator for patient who is intubated. A patient with COPD requesting assistance to the bathroom. COPD patient requesting assistance to bathroom, that is stable patient, right? Not gonna die. A patient with pneumonia who has pulse oximetry reading 93 on 2 liter oxygen, that is stable patient, right? Above 90% oxygen is stable patient. A family member asking to speak with this nurse about the plan of care, that is also, that patient can wait and stable. So only option number 1, the high pressure alarm is sounding on the ventilator for patient who is intubated, that's mean airway is compressing. Airway, there is a problem in the airway breathing. Maybe his ventilator tube is kinked or is disconnected, so that's why ventilator alarm is going off. So that would be your final answer. Answer A, airway breathing circulation problem, right? ABC category. So that comes to an end of our 5 practice question. I hope you got an idea how to crack your answer, right? So you have to go each category, check if it's asking for ABC. If not ABC, then move on to next category, stable versus unstable. If not, then move on to acute chronic, and fourth, who gonna die first if I don't intervene. So that's how you try to crack it, right? So we're gonna do more practice question like this in future, right? And I will post explanation also, which is gonna be like few seconds. You just have to pause the video to read it, right? Again, all this question I got from the online sources. Nothing belongs to me. This is just for practice and just for learning purpose, right?